Bill, you live in Canyon, Texas, and it's one of the probably the highest allergen-laden places in the universe. Do you recommend peroxide because of its superiority in patients who are sensitive or allergic? I know that that's really been a mantra that I think most of us have expressed and believed. Do you find that to be true?
I do, and I find that people who tend to be to have allergies, to have atopy in general, are typically going to be people who may be more prone to develop a sensitivity to the components in solutions, in multipurpose solutions.
Well, the question.
I have yet to find someone who's allergic to hydrogen peroxide.
Well, the question is, and I'll ask. Actually, I'll open it up to the panel here. Is that dogma, or is that reality? I mean, I haven't seen a sensitivity to an MPS preservative in a long, long time, but yet I also tend to think peroxide when I see an allergic patient. Chris?
Yeah, absolutely, and quite frankly, not just allergy, but many ocular surface diseases. Lid disease, allergy, and dry eye, I tend to shift patients more in the direction of peroxide, particularly Clear Care with its additives, and I find them to be quite comfortable. But I have not seen a clinical trial to support that. It's really been my anecdotal experience and my successes that keep reinforcing that practice.
Well, that's interesting. You said dry eye. What's your rationale for that?
What really, in my mind, brought Clear Care to a great place in practice was the transition to a one-step system, which improved compliance. But the addition of Pluronic 17R4 as a surfactant,
right.
Really an excellent additive. It does a lot of interesting things that previously hydrogen peroxide systems did not really tackle in terms of aiding in the wettability of a lens through the actions of things like micelles, which are very analogous to macrophages, to clean up debris on a lens, to really go after lipid and cholesterols on lenses. Now we have the advent of silicone hydrogel lenses. Those things are problematic, and I think that additive has really assisted in dry eye practice with contact lens wearers.
Interesting. Anyone else have similar thoughts?
Well, I typically think of, let me back up here, the multi-purpose disinfecting solutions that we have at this point are so highly advanced, and they have these surfactants that are so advanced and are built for these difficult type of patients that I actually position Clear Care peroxide systems at a little different place than you, Dr. Levens, in that I'll usually go MPDS first, and if there's any what I see as a perceived hypersensitivity to the solution, or if there are any ocular allergy issues, I'll usually think of peroxide systems. When I see allergy patients, these patients too, it's not like their main symptom is itching. Their main symptom is the redness. But when we look at these contact lenses, they just physically look different because those eyes are more active, they're producing more mucus, they're producing more discharge. These things tend to deposit on contact lenses more readily. And I just find that for those patients, oftentimes it's easier to move them to a peroxide system and really attempts to keep them cleaner for the reasons that Chris was actually talking about. And for those patients, I have a high rate of success when I do switch them to a peroxide-based system.
It's interesting. My experience is similar to yours as well, although I certainly understand your perspective. I find that for patients that tend to have dry eye, because of all the advances in the MPS, advanced MPS products like OptiFree Pure Moist, they're really optimized for patients that have dry eye, just in terms of maintaining a wet surface. Peroxide does work well, for many patients, but it tends to be not my first choice for those patients. But I think that's the beauty of having so many choices. I think that's a really great thing. Go ahead, Chris.
Art, I'll echo what you're saying here. I think a lot of it comes down to the surfactant that is used and the compatibility of the surfactant with both the contact lens and the ocular surface. And so the drier the patient, the more the surfactant in the contact lens solution is going to matter. And so typically if I have somebody who's very dry, I will put them into a product that has a highly effective surfactant, like you said, Pure Moist, first, and then see how they react to that before I necessarily change them to a hydrogen peroxide system. I think it really makes sure you need to match your solution to what the actual problem is. Everybody thinks that they're sensitive, and everybody thinks that they have allergy. But the fact of the matter is most of these people who are sensitive or have allergies actually have dry eyes.
That's a great point.